The prospect of receiving a COVID vaccine has many optimistic that the pandemic will soon end. But it could be months before everyone who wants a shot can get one. And meanwhile, people are still getting sick and some will succumb. Now, local hospitals are offering a treatment for patients in the early stages of a COVID infection who may be at risk for a serious battle with COVID-19. And here with more on that treatment is Dr. Andrew Thompson with St. Luke's Infectious Disease Associates. Dr. Thompson, thank you so very much for being here tonight. Would this part of Minnesota and Wisconsin be considered a hot spot for COVID?
Not right now. You know, in November, especially late November, we were a hot spot. We were one of the states that had some of the highest rates. But since that time, we've had a really nice decline in our number of cases. And so now we're in the lower tier of activity in the United States.
So we're starting now to see some light at the end of the tunnel here?
I hope so. I am optimistic that this will continue, but I do think we have to keep our guard up in the months ahead.
I want to get this right. You're familiar with a treatment called monoclonal antibody treatment. I hope I'm saying that correctly. Would you explain that? How does that work?
Well, monoclonal antibodies are sort of an artificial way of creating antibodies. It's a medication that administers antibodies, which are the things our bodies make in response to an infection.
Now, you don't go to the hospital or clinic for a shot. That's an infusion.
Well, these are given by infusion. And so in order to get it's a biological product. So you can't get it in a pill, and you have to get it through an IV.
And how long would that take?
It takes about an hour to administer. And we observe people for about an hour afterward to make sure that they don't have side effects and that they tolerated it well.
Would a person actually have to have COVID-19 then, the ailment?
Right. We know that the best use of this treatment is for someone who is early on in their infection, so they were recently diagnosed, and they have to test positive, as well as have some underlying risk factor that makes them at higher risk of complications.
So I was just going to ask you, what are the benefits of having it done this way, your treatment? I think you just mentioned a good one there.
Right. So really the studies that have been done on this have shown that if people get treated early, shortly after they have the onset of symptoms, this can prevent hospitalization. It significantly brings down the risk that they'll have to go into the hospital or their disease will become more severe.
So it brings down the risk of death as well.
Yeah, we don't have great data showing that, but that would be something you could infer.
How's the vaccination process going, Doctor?
Well, that's a good question. We have a great process set up at St. Luke's. We've vaccinated a lot of our employees who fit into the first priority categories. We have started to vaccinate some patients, but the supply of vaccine is really limited. That's what's limiting us right now. And it's not unique to where I work at St. Luke's, it's all across the region.
So it sounds like the vaccines are working, it's shortage of supply.
Exactly.
Is the big issue.
Yep.
Do you see that changing soon?
You know, I'm optimistic. I think the companies that currently have approved vaccines are trying to pump out as much as they can, Pfizer and Moderna. And just today we received news from both Johnson & Johnson and another company called Novavax. They haven't released their findings, but they put out press releases, which unfortunately is how we learn some things these days, that there's good efficacy of their vaccines in the trials.
Doctor, many of us get flu shots every single year. I've had mine for decades. Is this something that'll happen with COVID too? Will there be an annual shot, do you think?
Good question. We don't yet know. We don't know how long the vaccines will last, how effective they will be in the long term, and how long COVID will be around. We do know that these vaccines are more effective at preventing COVID than the flu vaccine is at preventing flu.
Really?
Much better.
So I really wanted to know too, we have stronger forms of COVID coming in from Africa, I think Brazil. So how concerned should we be about that? Is that starting to spread?
Yeah, so these are what we call variants, and they're basically mutations in COVID When COVID mutates, sometimes it gets a little more contagious, sometimes a little less contagious, maybe causes worse disease or less severe disease. We still have a lot to learn about these. There's concern that they could be more contagious. We don't have a lot of solid evidence of that, but there's definitely concern of that. And especially with all the international travel going on, we're worried that one of those worse mutations could take over and cause a lot more disease here.
Sure. One other question as we're wrapping up here, Doctor. Wearing masks, still highly recommended.
Absolutely. Masks will work against any new variant. It doesn't matter if the vaccine is effective, you can prevent that with a mask. You can protect your neighbors by wearing a mask. That's really the way to get this pandemic under control.
All right, Dr. Andrew Thompson, Infectious Disease Control, St. Luke's Hospital here in Duluth. Thank you very much, Doctor.
Thanks for having me.
Appreciate you being here.